Hello, everyone. I'm Dr. Farah Ingle, Senior Consultant Physician, Diabetologist, and Director, Internal Medicine, Fortis Hiranandani Hospital, Vashi, Navi Mumbai. Today, I would be talking on diabetic foot care. So, we all know that diabetes is like an epidemic. It is affecting people of all ages. Now, when the blood sugar level fasting goes beyond 110 and post lunch is more than 140, and glycosylated hemoglobin, that is HbA1c, is more than 6.5, it is called as diabetes. And diabetes is one such problem which can affect you from head to toe. You can get strokes in diabetes, which are 5 times more common than those in non diabetics. You can get myocardial infarction or heart attacks without any symptoms and signs, which is called as the silent infarct, which is 2 times more common in diabetics compared to non diabetics when it's not under control, especially. You can get premature cataracts, glaucoma, retinopathies, you can get kidney failure. Those patients on those who are on dialysis, life is a hell for them actually. And then you can have affection of the nerves, affection of the blood vessels, you can get wounds and so many problems because of diabetes. Now, stroke, cardiac problems, kidney problems are at least to some extent understood by general public, and they have a scare for them. That is why that is being monitored. The awareness regarding these problems is little better compared to diabetic foot, which I can say is a neglected entity. But if you see, it is on our feet, we stand and we walk. It is a locomotor organ of our body. It's a small foot which has about 26 bones. One foot has 26 bones. So 2 feet together has 52 bones of the 206 bones of our body. It has about 33 joints in each foot and about 100 muscles, connective tissues, and ligaments. So it's a complex structure on which we stand, on which we walk. And if you know, longevity is mobility. If you're mobile, you live long. So you have to concentrate on your foot, which is actually a neglected part of diabetic management, but a very important part. What happens in diabetes, as I've told, that the nerves also gets affected, which is called as peripheral neuropathy, because of which the sensations of the foot gets reduced. It begins with a sensation of burning or tingling, numbness, feeling of pins and needles in the foot, which is suggestive of neuropathy. And also, because the peripheral arteries are affected in diabetes, blood circulation in diabetes, it will not. It is which is non-traumatic because of diabetes. So it's very important that we take good care of our foot. We have to wash our feet with mild shampoo or mild soap and preferably lukewarm water. But someone else should check the temperature of the water and you wash it thoroughly every day and keep it dry. Because if you keep the foot wet, especially in the webs where it is wet, you can catch up fungal infections. Then you have to use a proper footwear. The footwear has to be comfortable, it has to be properly fitting, and it should be made with special material. Normally, we advise, because what happens in diabetic foot, the shape of the foot also changes. You can get corns and callosities of the foot, and then that pressure area which is developed repeatedly, you will get hurt over there. You can get ulcers on the foot over there, which can develop into cellulitis. It can turn into necrosis, and you can lose the foot because of that. Now, there are different stages of diabetic foot. It is from stage 1 to stage 6. Stage 1 is a normal foot, and stage 6 is a foot which cannot be preserved, where nothing can be done to the patient. So, from stage 2 to 5, you should try concentrating, and we can actually help those patients out. So it's important that you observe. So if you develop a con, a callosity, if you feel that the footwear is not fitting you properly, please consult the doctor immediately. So we have to use a properly fitting footwear which is comfortable, specially made of MCA material, specially custom made, because in case if you have calluses, cons, then you have to offload that area. Otherwise, constantly you'll get hurt over there. If you're not wearing shoes, in case you want to wear sandals, then you should wear a sandal with a back strap. Otherwise, because once the sensations are reduced, and also when the muscles get involved, especially when the distal muscle involvement is there in diabetes, the footwear can slip out. So it's important that you wear a footwear with a back strap. Secondly, you have to keep your foot moisturized. So, because you may not understand, because the sensations are reduced, you should inspect the feet every day before going to bed. Check your foot. See that if there are any marks on the foot, cuts on the foot, burns on the foot, or if there are callosities, calluses, or something, then you inform the doctor immediately. You keep your foot moisturized. That's very important. Then socks also, even diabetic socks are available, or otherwise you can use thick socks which is made of cotton. At some places, for different reasons, you may have to remove the footwear. In that case, you can even use socks which are padded, that will support your foot. And most importantly, is to keep the sugars under control. All these complications will happen when the sugars are not under control. So that's why it's important that you follow proper diet, which is diabetic diet. Avoid taking sweets, sugars, jaggery, honey, fried food, fast foods. Limit the calories. Intake should be as per the expenditure. Do regular checkups even for the other systems, because from time to time, because I've said that diabetes is one problem which can affect any system of the body. So regular checkups with your diabetologist is must. And be active. Go for walks every day or do some activity, and don't get stressed out, because total health is physical plus mental health. If you're not at ease mentally, then in spite of following proper diet, doing exercise, taking medicines on time also, the sugars can go up. So be active, follow the diet, exercise, and be relaxed. That will go a long way in protecting you from getting the complications of diabetes. So, thank you.